Loneliness is a far bigger problem than people realize. We think because we have more technology to connect us than ever before, and because we have more people living in densely populated cities, that people are connected, that they're around people all the time. But there's a difference between being around people all the time and actually having substantial, high quality relationships with them, where you are truly understood by another person, where you can give and receive support with someone else, where they can nourish you in the same way that you nourish them. And over time, what we have found actually is that since the 1980s, the levels of loneliness among adults in America has in fact been growing at a time where we are more technology connected than at any point in the history of civilization. So this has been quite striking to me. What's particularly concerning about it is that loneliness is associated with serious health impacts. So loneliness, for example, is associated with a reduction in your lifespan that's comparable to the reduction in lifespan that you see with smoking 15 cigarettes a day. And it's greater. It's greater than the reduction in lifespan that you see with obesity. And we see that loneliness is associated with greater risk of cardiovascular disease and dementia, depression, and anxiety. And if you want to understand why, it's worth reflecting on the fact that over time, over thousands of years, in fact, we have evolved to be social beings. That doesn't mean we're all extroverts. In fact, we're a mix of introverts and extroverts, but it means that we all have some need for social connection. Because in thousands of years ago, your social connections, your ability to build trusted relationships with other people, gave you a leg up when it came to having a more stable food supply or being protected from predators. And over thousands of years, that's become baked into our nervous system, such that when we are experiencing a lack of social connection, insufficient social connection, it places us in a physiologic stress state. And when we are in a stress state for a prolonged period of time, then that leads to greater levels of inflammation in our body, which lead to a host of chronic illnesses, including heart disease, diabetes, cancer, obesity, and the list goes on. So this is why loneliness is so important for us to think about, because it's growing in prevalence. It has important impacts on our health, and it has implications for our performance in school and in the workplace as well. There's data showing that employees who are disengaged from each other become disengaged from the workplace as well. And so, what we know is that when people are feeling isolated, when they are feeling like they are not connected with those around them, then that impacts their motivation, it impacts their creativity, and ultimately, I believe it impacts their longevity as well in the workplace. So loneliness is a really important topic. It is unfortunately something that people don't often talk about because they feel ashamed to admit that they're lonely. And I shared with someone recently, in fact, after this article came out, that I myself experienced a number of years where I was quite lonely when I was a child. I was very shy. I had trouble reaching out and making friends, and I felt great about my relationship with my parents and my sister. I knew that they loved me. I loved them. I knew that they were always there for me, and I didn't feel lonely at home, but I felt lonely outside of home, and I felt ashamed to admit that to them. So to this day, I've actually not said that to my parents.